In 2020, a 39-year-old woman with Down syndrome tragically experienced a ruptured aneurysm in her brain. She was not brain dead, but she was not expected to survive. Her parents consented for her to become an organ donor after what was known as cardiac or circulatory death. After consent was provided from the family, she was removed from the ventilator. Her heart rate and oxygen saturation levels dropped rapidly. She had no measurable blood pressure, no oxygen saturation, and no respiration. A physician listened to her heart for an additional 2 minutes. During that time, no heart tones were heard. She was pronounced dead at 2:59 a.m. After cardiac death was pronounced, they began organ procurement at 3 a.m. It was seen that her aortic and renal arteries were pumping and pulsing. The organ procurement was stopped. It was noted that she had spontaneous agonal respiration. At that time, the patient was given additional doses of fentanyl and lorazepam. Subsequently, she was pronounced dead a second time at 3:17 a.m. The cause of death was determined to be homicide. In layman's terms, her heart started beating on its own again, and she started gasping for breath during the removal of her kidneys. Out of pure mercy, her doctors gave her an overdose of narcotics and sedatives, following which she died. The American Journal of Case Reports, a medical journal, published an article on this case in May of 2021, but the article does not discuss what legal ramifications, if any, ensued. I'm Dr. Heidi Klessig, a retired anesthesiologist and pain management specialist, and the author of The Brain Death Fallacy. So what is donation after circulatory death? And how could something like this case report possibly happen? During the early years of transplant, prior to 1968, organs were removed after biological death for transplant, but there was a problem. Organs procured in this way were deprived of oxygen, resulting in tissue breakdown, making them unsuitable for transplant. Doctors needed a way to work faster, so definitions were changed to shorten the time after cardiac arrest before death could be declared to as little as 120 seconds. Here's how donation after circulatory death, or DCD, works. First, these patients are not brain dead, but are either not expected to survive or have decided that their quality of life is unacceptable. Second, their death is planned to occur at a specific time and place so that organs can be harvested. Third, the patient is taken to the operating room or a room nearby with the transplant team ready to start harvesting as soon as possible. Fourth, medical support is withdrawn and the patient is monitored until their pulse stops. DCD does not require EKG silence, but rather no pulse. Fifth, after 2 to 5 minutes of pulselessness, depending on where you live, there is no universal standard. The object is achieved, and these people are immediately harvested. This practice is controversial. Many medical professionals are uncomfortable with this quick time frame as people are routinely resuscitated within 2 to 5 minutes of cardiac arrest. And if you can be resuscitated, you are never dead. Picture yourself at a concert. Suddenly, an elderly gentleman sitting in front of you collapses. While someone looks for the defibrillator, you and other spectators place him in the aisle. Someone is asked to call 911. Unfortunately, no one is present who knows CPR. The person who ran after the defibrillator makes good time and arrives with the equipment, and the paramedics are on their way. Using the provided scissors, his shirt is cut away, and because he has a particularly hairy chest, you have to shave it with the provided razor before the pads will even stick. The defibrillator charts his heart and delivers a shock. By now, sirens are heard in the distance, and luckily, following defibrillation, his heart starts beating as the paramedics run into the room. How long do you think this would take? Certainly more than 120 seconds. This man was never dead. In 2007, Dr. Ari Jaffe, a clinical professor of pediatrics and critical care at the University of Alberta, did a literature review and found 12 patients whose hearts restarted spontaneously without any medical intervention after as much as 10 minutes of cardiac arrest. Some of these people even made a complete recovery. According to the law under the Uniform Determination of Death Act, death requires the irreversible cessation of circulatory and respiratory functions. If you can be resuscitated, you were never dead, according to the law. Yet people well within the time frame of resuscitation are being declared dead enough to have their organs harvested. Donation after circulatory death is banned in Finland, Germany, Bosnia-Herzegovina, Hungary, Lithuania, and Turkey. In fact, Germany refuses to accept organs from Eurotransplant because some of them may have been procured using the DCD protocol. Sociologist Renee C. Fox sharply criticized the donation after circulatory death protocol, calling it, and I quote, an ignoble form of medically rationalized cannibalism that borders on ghoulishness. A death declared after 120 seconds of pulselessness is not death and exists only for the sake of organ harvesting.